Welcome to Research That Matters. On today's Smart Chiropractor show, the clock and the calendar has turned. We are in August. That means we have a new monthly campaign going on and a new weekly topic. If you have been following along, you know at the Smart Chiropractor, we believe in a core philosophy of teach and invite consistently. That is how we think about content creation. That's how we think about email. That's how we think about social media. What can you teach? Because that gives you the opportunity to invite. And if you do that consistently, you're going to build an awesome practice. We've been showing examples of this each and every week through our member highlights, through our featured guest interviews. But for today's episode, we're talking August 2022, which is where we're at today. And our monthly campaign switched over to, in my opinion, one of the most important campaigns that you can discuss, which is how does an adjustment work? There's so much to dive into with this that it is incredible, but you think about how little people know about chiropractic. Think about how little people then know about what actually happens when the care that you deliver occurs in your practice. It is a wealth of misinformation and non-information, and it is our job, your job, all of our jobs to fill in that knowledge gap. Now, we break those monthly campaigns. That's a big topic, as I said. That's why it's a monthly campaign. Our weekly topic is the Facet Joints, gliding your way to better health. I always think of the Facet Joints as they glide and gap. That is their job. And the Facet Joints, as we know, as we age, we're under the stress of gravity, injuries occur. Facet joints get loaded with increased load as we age. Why? Because our axis of rotation migrates posteriorly. So as we age, our facets undergo excess load year after year, after decade, as we age. And quite often, those facets can have or cause restrictions in movement patterns, whether you're using DNS, SFMA, however you're assessing movement, straight up range of motion and goniometers, however you're doing it, you probably have noticed that when people's facets are not gliding and gapping the way that they should, biomechanics are altered. That's a challenge. And then you deal with a cascade of challenges from that. And ultimately, that can impact really, it only takes one or two steps, just about anything in our lives. We've touched on previously how it can affect posture and how posture can be interwoven with our mood and depressive-like symptoms. It can go all the way over, of course, to pain. And clearly, it can affect performance. If you're not able to cleanly and clearly move through a great segmental and regional range of motion, you can't have optimal performance. So this is a very, very important topic. There's a lot of things that happen when an adjustment is delivered. We're going to get to those as our weekly topics unfold, but we're starting it out with the facet joints. And why is that the case as well? Because the facet joints are the knuckles of the spine, and quite often we're describing what we do in the noise, that cavitation that occurs when an adjustment is delivered. We're addressing it in relation to the facet joint. So it's a core conversation. All of our Smart Chiropractor members are getting everything we're discussing right now in consumer speak. So we're breaking it down so it's easy to understand. We're giving you the video scripts, the email templates, and the social posts so you can get out there with this information. I always like to take a few minutes on this show and speak more at that professional level about why we're thinking about this topic and how you can think about the topic. But if you want help delivering this information in the best manner possible, that is where our Smart Chiropractor members live. That's what they get, and that's what we help them do. You can check that all out at thesmartchiropractor.com. Jason, thoughts on the topic that is about as big as it gets, how an adjustment works?
It is. I mean, that would seem to be a pretty obvious thing that people would want to teach people. I should say chiropractors would want to teach people. But that's part of why, this profession, I think, is sort of the tail's wagging the dog. There's so much emphasis / desperation on needing to get them in that we have a tendency to just simply lower our standards because of our need as a profession to get people in the door instead of teaching them what it is that they need to know about how their bodies work and why, making sure that they stay adjusted, stay well adjusted, stay aligned, keep motion and movement in place. However you like to teach your people about why you do what you do, that's the point. And that is what you're going to hear us talking about over and over and over. That's that consistency part, is making sure that you're not just deep discounting your way to new patients and lowering the bar, but in fact the opposite. You are raising the bar. You are attracting people that actually value what you do, not people who are willing to spend as little as possible to come check it out to get what they think you do, which is often a fast fix for free. If that's the kind of practice you want, then don't pay attention to anything that we're talking about. But if you are looking to attract people that value your work, that look to you as a doctor, not a discounter, that look to you for both the ability to help them get out of pain as well as understand this new idea that chiropractors actually can help you promote your well-being, help you improve your performance, can help all types of conditions in a variety of ways. More specifically, let me appropriately say, help your body heal from all sorts of conditions in all sorts of ways, then teaching them on a regular basis, starting with how does an adjustment work, maybe one of the most important and valuable topics you can. Again, all complex doesn't have to be. Make your life simple. Check out thesmartchiropractor.com. This segment is sponsored by thesmartchiropractor.com. They make it all possible for us to get on here and teach you on a regular basis what you can be doing to teach them on a regular basis. Smart Chiropractor makes it super easy and simple. I'll even dare say maybe even a little bit fun. Sometimes fun is challenging yourself to do things that may feel a little bit uncomfortable. Sometimes fun is getting all that feedback from people that see you wherever and go, saw your video, that was awesome, shared it with my friend, I've been trying to get them in here, etc. So just keep the formula going. Teach and bite consistently. How an adjustment works is one of those most important topics if you're a chiropractor that wants people to actually understand what it is that you really do.
That is correct. If you want to build a practice, you gotta be out front. You have to teach and invite consistently. We've seen that time and time again, and I think many docs are tuned into that, but they struggle with the implementation. If that sounds like you, then head over to thesmartchiropractor.com. We'd be happy to help you teach and invite consistently across all of those platforms that have the highest impact so that you can attract more new patients, you can improve your retention, you can have more reactivations without spending any money on advertising. That is what we promise, and that is what we deliver for our members each and every month. Thank you so much for watching this video on the Smart Chiropractor. To not miss a single thing that's clinically oriented, marketing oriented, or more, be sure to subscribe to our YouTube channel today.